persuasive speech about why wearing a face mask is important for your health and others. As I said in my first speech about me, I said that I work at a local hospital in the medical intensive care unit. So I picked this topic because I see firsthand what this coronavirus is doing to people of all ages and how it's affecting them and their lives. This is a crazy time we live in, and I think if everybody just can come together and just wear a simple face mask, that we could slow the spread of COVID-19 and try to get back to a safer and healthier world. So I'm going to highlight some things about washing your hands, why that's important, and social distancing, and of course why wearing a face mask is beneficial. And hopefully you go away with a bigger picture about why I feel this is so important. So what is social distancing and why should you be practicing it? So social distancing is to practice social distancing. Make sure you stay at least 6 feet apart for you and someone else. So don't be right on top of them if you are going out for essential items at the grocery store. And if you're going to go out, make sure that you're going out with someone in your household with a mask on, and once again, practicing social distancing, keeping 6 feet apart from strangers. So in this slide, this shows how social distancing helps slow down the spread of COVID-19. Many people are walking around not knowing that they have COVID-19, and that's one of the reasons that this is so rapidly spreading. If you're around somebody that is coughing or sneezing, you can breathe that in if you're not wearing a mask, and that's how the virus enters your body through and starts affecting your respiratory system. Before you go out, know your rules that your town or state have put in place for social distancing and wearing masks. Make sure you're only going to places that are essential, like the grocery store or pharmacy. Social distance while going out. Try to do things like curbside pickup for food and groceries, and try to limit your face-to-face contact with people. So my next thing is washing your hands. This is so important. I think every day we go out and we just go, do, and we don't realize everything that we're touching. And then majority of the time, everybody reaches and scratches their face or rubs their eye. And that is actually putting those germs right into your body. So how often should you be washing your hands? Well, all the time, every time. You enter a building, before you go and sit down, wash your hands. Use hand sanitizer if it's on you. You don't think that the elevator buttons that you touch are carrying so many germs, the handrails. Just make sure you wash your hands before you eat, and according to the CDC, they say to wash your hands for at least 20 seconds with warm to hot water. Make sure you scrub your hands. Make sure you get under your nails, in between your fingers, and then rinse. You could sing happy birthday, or if you have an Alexa or Google, you could have them set a timer so you know you're actually washing your hands for 20 seconds. And like I said before, practicing good hand hygiene will eliminate getting you sick and others sick. If somebody coughs or sneezes on a surface and then leaves and you don't know, you put your hand down and then you rub your eyes or eat, that's going right in. So why should you wear a mask, and why is it so important? So when the coronavirus first started, the CDC came out and said only the sick should be wearing a mask, which yes, they should be, but as this virus progressed, the CDC said, hey, listen, we have to have everyone wear a mask because people are asymptomatic and they don't know, they're not showing any symptoms. They don't know, they're just feeling fine. So they came out and said, hey, you know, everybody has to wear a mask. Some studies have shown that 40% of people have no symptoms and they don't feel sick in any way and are still walking around with maybe not a mask on. A lot of people are super confused about what kind of masks there are. Here we have just your regular cloth mask that everybody's been running out and making. This is intended for droplets, it's better than nothing, and it can help you and your loved ones or people around you when you're going to those essential businesses. Here we have the surgical mask. It's a loose fitting mask that protects from bigger droplets from entering. It has a filter on the inside. They're more commonly used in the hospitals or in the medical field, but you can also wear them as well. And then over here we have the N95 respirator mask. So this is designed with the filter inside and a complete seal. A lot of people in the medical field, including me when I go to work, this is what we have to wear for 12 hours. It's specially fit to us. We have to get fitted every year. You're not supposed to smell or taste anything. This is supposed to block up to 95 of pathogens. And that's the lines you're probably seeing on Facebook if you have friends or family that are working, or are nurses or in healthcare, that are all red and sweating. They're not fun to wear all day. So aerosols and droplets. Aerosols and droplets are when speaking or sneezing or coughing. They come out of your mouth, out of your nose. It's saliva or mucus. That's what they're finding is living on surfaces and what you do not want to breathe in. So that's why wearing a face mask is important. So there's at least some type of barrier between you and your respiratory system. This is a video that was made at Nebraska Medical Center. They put together, they use a laser to show how droplets spread with and without masks. So I'll show you a clip about how they use that laser and what they found.
Now I'm recording.
Stay healthy.
Great,
Stay healthy.
great. Less loud.
Stay healthy.
Good.
Are you recording?
Yeah.
Stay healthy.
Louder.
Stay healthy.
Louder.
Stay healthy.
Nothing.
So as you can see in the video, that with the mask, you saw 0 to none, 0 to maybe a little bit of droplets, but that was nothing compared to when he was yelling and quietly saying, stay healthy. the whole screen lit up in green. That was the laser showing you the droplets spreading toward someone. It could be someone, it could be going towards. So at the end of this, we really need to be wearing masks. We have to be very safe. We have to think about us, our loved ones, and people we might encounter out at the stores. I have seen way too many people passing from this virus, going to work. There are healthcare workers, doctors, nurses, CNAs, even our housekeepers that are being exposed to this day in and day out. And they don't want to come home and have to worry about spreading it to their children or husband or wives or spouses. Just think there are 21.4 million people that live in Florida as of 2019. When you go out, just in the state of Florida alone, just try to think about that number and that person that you're standing behind or in front of doesn't have a mask on. They could be symptomatic. Try to put your political views aside and stop trying to listen to that this is a hoax, this is made up, the government made it, I'm fine. You're not fine, because a lot of the patients that I've been dealing with have told me, oh, I didn't wear a mask, I thought this whole thing was made up. And here they are 2 days later being put on a ventilator because they're too tired and cannot breathe. So I hope this puts a bigger picture into perspective, and to think next time you walk out your door to say, let me go get that face mask and let me go put that on. I don't want to be a risk to my community. Thank you for listening. Have a good day.